Welcome to the Michigan Trauma Quality Improvement Program. In this section of orientation, we will review end-of-life processes of care. Withdrawal of life-supporting treatment is described as treatment that was withdrawn based on a decision to either remove or withhold further life-sustaining intervention. This decision must be documented in the medical record and may be associated with a discussion with the legal next of kin. A note to limit escalation of treatment qualifies as withdrawal of life-supporting treatment. These interventions are limited to ventilator support with or without extubation, dialysis or other forms of renal support, initiation of medications to support blood pressure or cardiac function, or a specific surgical, interventional, or radiological procedure, for example, decompressive craniotomy, operation for hemorrhage control, or angiography. Note that this definition provides equal weight to the withdrawal of an intervention already in place, for example, extubation, and a decision not to proceed with a life-saving intervention, for example, intubation. If an actual withdrawal of life-supporting treatment is done, for example, patient is extubated for terminal wean, report the time the withdrawal is done. A DNR order is not the same as withdrawal of care. Discontinuation of CPR is excluded, as withdrawal of care typically involves prior planning. Include brain-dead patients where care is continued after brain death is declared when withdrawal is done in coordination with gift of life. Also include patients who are made comfort care only, which is often documented in notes or orders. Withdrawal of life-supporting treatment date is the date treatment was withdrawn. Report the date the first of any existing life-sustaining intervention is withdrawn. For example, extubation date. If no intervention is in place for withdrawal, record the date the decision not to proceed with a life-sustaining intervention occurs. This may be in the form of comfort measures only discussion or orders. If withdrawal of care is being done for brain death patients in coordination with gift of life, record the date brain death is determined. Withdrawal of life-supporting treatment time is the time treatment was withdrawn. Report the time the first of any existing life-sustaining intervention is withdrawn, for example, extubation time. If no intervention is in place for withdrawal, record the time the decision not to proceed with a life-sustaining intervention occurs. This may be in the form of comfort measures only discussion or orders. If withdrawal of care is being done for brain death patients in coordination with gift of life, record the time brain death is determined. Organ donation request is simply whether there was a request for organ donation during the patient's hospital stay. Organ procured date and time refers to the incision date and time organs were procured. We have provided a list of different organs that may be procured in a gift of life case. Please capture all that qualify. Mortality classification should be reported on all deaths. Report the final mortality classification as determined by your PIPS committee review. An unanticipated mortality with opportunity for improvement is defined as patients whose death is unexpected in relation to their injuries and pre-existing conditions. These deaths are considered to be potentially preventable and should have opportunities for improvement. A mortality with opportunity for improvement is defined as patients whose death is anticipated, but where potential system or provider improvements or gaps in care could be identified. A mortality without opportunity is defined as patients whose death is anticipated and no system provider improvements or gaps in care could be identified. Thank you for watching.